Anishinaabe the Anishinaabe Minnow-A-Awin People in Good Health course this month. This ICS training was created for leaders within the healthcare system to learn the importance of adopting culturally safe practices when serving Indigenous peoples. It accounts for the social and historical context, as well as structural and interpersonal power imbalances that shape one's health experiences. Anti-Indigenous racism has profound negative impacts on the health and wellness of Indigenous communities in Ontario and across Canada. And I ask you, my colleagues, to reflect on your continued action to support Indigenous health equity and self-determination of all Indigenous people. We are fortunate today to have First Nations, Inuit, and Métis elders with us offering opening prayers to close out our year. So I will now move to the podium and we will continue from there. Okay, thank you. So we're fortunate today to have Inuk Elder Ripa Evick Carlton joining us online. Also First Nations Elder Irene Compton also joining us online, and here today in person, Métis Elder Senator Parm Berge. We will begin with remarks by Ripa Evick Carlton.
Thank you for having me this evening. My name is Ripa Evick Carlton. I'm originally from a small community in Nunavut called Pangnirtung. There's about, I would say, 1,600 people there. I've been in Ottawa since about 1991, and I'm going to be lighting the traditional oil lamp, which we call the Pudlet in Inuktitut. And I also want to explain the significance of it so people can have a bit of an idea how this tool will allow my people to survive in a harsh environment, especially in the winter months, the dark season. So the Pudlet was their main source of light inside the salt house. Hammak, we call the salt house Hammak in Inuktitut. It was a source of warmth and also source of cooking tool. And then also in the winter months, people would dry their clothing over the flame of the Pudlet. And so I also like to say that I was born at that time when my parents were still living along with other families in this little camp that I was born in. I have wonderful memories from that time of my life. My early years were spent on the land. And I'm lighting the Pudlet in memory of my ancestors because I don't know if I could survive like they did for many, many years. So the Pudlet also to say that the wick came from two plants mixed together that you collect from the land. This hard texture, it's brown, and then the cotton. You mix the two together so that we can last long. And the Pudlet can be on as long as the oil is in the center. And the oil back then came from any animal fat like seal blubber, whale blubber, or even caribou fat, and also fish oils is what I've heard. For Inuit that live inland, not near the ocean, they use these other oils. So it's cozy, it's warm, and it's perfect for this time of the year to have the kullet on here at home. So I would really express that I'm a proud Inuit and also so grateful that our ancestors did all this work with really nothing, no stores, no electricity, just the families, the land, the ocean, the sky, and survived. And they called it the good life, the simple life. And I long for that sometimes because it brings wonderful memories, and it brings me back to a good space in myself when I think about these things. And so before I say an opening prayer, I want to share about the formality gate, which are still used. They were more used back in the time when Inuit lived in small groups, and so these maligate are essential beliefs that Inuit have held for generations. Elders describe maligate as fundamental laws. They define how we should live with each other. They also define how we can connect with our environment. Maligate are also foundation of Inuit Kaulimayatukangit, which are values and beliefs that Inuit have always known for a very long time. And they also provide us with a foundation for our spiritual development. And I think they're very fitting to this new relationship that we are building, because anybody can use them. Number one, working together for common good of everyone. Number two, maintaining harmony and balance, which we all need. We all need to be able to try and always have that harmony within us and within other people, and the balance within ourselves, especially in this very busy world we're living in. Number three, respecting all living things. And number four, continually planning and preparing for our future. And I like to say thank you to everyone who does their work so that we can live in a good city and caring for our people. And I know we have challenges to deal with, but with us working together and forming relationships, we can do this, and none of us can do it alone. So we need each other. I'll end with an opening prayer in my language, Inuktitut, for a blessing over the meeting, for safe travels back home, and to help us build good, healthy relationships amongst each other, because there's a lot of work to be done. So I'll end with the prayer. Hoyanna me lareguti, ullo katita waktasi ullutia pammi ikayokta ulluta asoalo. Hoyanna me larepitia wakta. Kikutuinauno piloato me ilinno nalligi yalo wakta. Tamata ikayulati gutaku alo katimani aktu. aulat ti yu ikayok tau kulugin. Sila tunamig tuniyaw kulugi ang masukoti sa tiang namig hilariang ini ilo aktumino nakakasima yunut ilaw ti tibalea ti lugi guti say maktikin taman na kubiagi gabiyo kay maikayok tigigong namuta hilari katigigong namuta pikuyi gabin sila to metamani ikayulaw tigu tamatatia kai kuyaw si mayo katikalo inaw yu ikayong logitaw ilabullo nunakatibullo isumagiyakayalibullo kanuili si mayo ayulot si mayo tamakwa isumasasiro taw katango sumata ikayulaw tigu kuyan na may laki nito ape atingago. Amen. Thank you. Thank you.
Nakomic, thank you, Elder Eva Carlton, for sharing your words with us. We appreciate it. Next, we will hear opening prayers from Elder Compton.
Anine, everybody, it's my honor to be here to open your gathering. And I'm just going to start with the medicines. We always cleanse ourselves before we invite those ancestors in. So I have some sage here, and I'm just lighting it. And you can see that they really want to visit. So we're going to cleanse our minds so that we'll have clarity and understanding. We're going to cleanse our ears so that we will listen with intent. And we're going to cleanse our eyes so that we can see a good future, especially for the city of Ottawa and all the people they serve. And we cleanse our mouth so that we be respectful to say good things to one another. And we make that connection from our heart to our Creator. And I like to cleanse my tummy because that's where all your emotions sit. And so I just want to take any kind of scattered emotions and we just want to ground ourselves to Mother Earth so that we can be truly present for one another. I'm going to open up with a beautiful welcoming song. And how we say welcome in Ojibwe is Bindigen. We're going to invite the grandfathers, which is Mishomis, the grandmothers, which is Nokomis, and everybody else is Nagiwagama. I'm going to start with 4 honor beats and take you into this beautiful song. So this is a heartbeat, and I like to think about my ancestors coming through that eastern doorway to sit with us and to motivate us and to inspire us. So let's open with the eastern doorway. Bindagan Mishomisak, Bindagan no Kamisak, Bindagan Nagiwagama, Waheya, heya, heya, ho. 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 And in that southern direction, we're going to pray for our youth. We're going to pray for their confidence, their well-being, and their leadership, because we know they are the leaders of the next 7 generations. Bindagan Mishomisak, Bindagan no Kamisak, Bindagan Nagiwagama, Waheya, heya, heya, ho. Waheya, heya, heya, ho. Waheya, heya, heya, ho. Waheya, heya, ho. Waheya, heya, heya, ho. And in that western direction, we're going to ask the spirit of the bear, our makwa, to be in our gathering today so that we can have courage to put things into place. Bindagan Mishomisak, Bindagan no Kamisak, Bindagan Nagiwagama, Waheya, heya, heya, ho. 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 All right, this is our last round, and I want you to think about your own ancestors. You know who they are because they're your helpers on your earth walk. And we just want to connect with them and invite them in. Bindagan Misho Misik, Bindagan Okabisik, Bindagan Naki Wagama, Waheya, Heya, Heya, Ho. All right, let's sing them in. Waheya, Heya, Heya, Ho. Waheya, Heya, Heya, Ho. Waheya, Heya, Heya, Ho. Hey-ya, 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 oh. Shimigwech, everybody.
Mig Grandmother Irene, thank you for your beautiful words and prayers. And finally, I'll invite Elder Senator Berge. Would you like to come up to the podium? And we'll just be briefly pausing the live stream. We're so honored to have you here with us tonight. And if we can restart the live stream, I just want to extend my thanks to all the elders who joined us. We are always so grateful to have you with us, to share your prayers, your reflections, and your teachings with us. So on behalf of the board, I just want to extend my gratitude to you to taking time out of your busy schedules to be with us and to help us close out our year with your light. So miigwech, Nicomoic Marcy. Thank you. And just give me one brief moment. I'll return to my seat. For the final time, Board Secretary, can we have the roll call, please?
Member Banham?
Present.
Member Bauer?
Present.
Member Brown-Shreves?
Present.
Member Carr?
Present.
Member Chung? Member Dudas?
Ici.
Member Gower?
Here.
Member Kavanaugh?
Here.
Member King?
Here.
Vice Chair DiGiovanni?
Present.
Chair Kitts?
Here.
You have quorum, Madam Chair.
Thank you. We have regrets from Member Chung. Are there any declarations of interest? Seeing none, confirmation of minutes of the meeting of November 6, 2023. Are those carried? Thank you. We have 3 communication items that have been received and held on file with the Board Secretary. Motion to introduce reports. Member Brown-Shreves, please.
Be it resolved that the Chair of the Board of Health verbal reports, the Medical Officer of Health verbal reports, and the reports titled 2024 Draft Operating Budget for the Ottawa Board of Health, Ottawa Public Health Submission to Health Canada on the second legislative review of the Tobacco and Vaping Products Act, and performance appraisal of Medical Officer of Health, in camera, personal matters about an identifiable individual reporting out, date not to be reported out, to be received and considered, and be it further resolved that the rules of procedure be suspended to receive and consider the revised version of the report titled Ottawa Public Health Strategic Plan for 2023 to 2027, Strategic Action Plan as circulated to board members on November 24th, 2023.
Is it carried? Thank you. We'll go through the consent agenda. So item 8.1 will be my verbal report. Item 8.2, hold for the Medical Officer of Health's verbal report. Item 8.3, 2024 draft operating budget for the Ottawa Board of Health will be held for a staff presentation. Item 8.4, Ottawa Public Health Strategic Plan for 2023-2027 Strategic Action Plan. Is this carried?
Hold.
Hold, sure.
Thanks.
We'll come back to that. Item 8.5, Ottawa Public Health submission to Health Canada on the second legislative review of the Tobacco and Vaping Products Act. Is this carried? Carried, thank you.
I just want to make a comment.
Sure. Brief comment, Member Kavanaugh? Or did you want to come back?
Yes, just a brief comment.
Sure, go ahead.
No, just a brief comment. No, I want to thank for all the work on this and appreciate the effort in getting young people not to smoke. So I just wanted to say thank you to all that were involved in that project. Thank you.
Thank you, Member Kavanaugh. So is that item carried? Thank you. Item 9.1, performance appraisal, a medical officer of health. If we do have questions, we will go in camera. Is that item carried? Wonderful. Thank you. Okay. So we will go back to the first held item, which is my verbal report. And I'd like to start my verbal report today by congratulating Member Brown-Shreves. She is this year's recipient of the Family Physician of the Year Award, given by the Ontario College of Family Physicians. She has also been named one of Canada's most powerful women by the Women's Executive Network. The Family Physician of the Year Award recognizes a family physician for their exceptional care of patients and for their significant contributions to the health and well-being of residents in their communities. In particular, Member Brown-Shreves was recognized recognized for her dedication in providing care to vulnerable populations. In recognizing Member Brown-Shreves, the Women's Executive Network counted her among 100 women who have transformed their fields by advancing diversity, equity, and inclusion, as well as addressing the needs of underrepresented populations. Au nom du Conseil de Santé, je tiens à féliciter le membre Brown-Shreves pour ces deux reconnaissances. These achievements highlight the incredible work you are doing. Thank you for providing exceptional care to your patients. Thank you also for working to advance health equity so that vulnerable populations in Ottawa can live with better health and well-being. We are very lucky to have you as a member of this board, so please join me in congratulating Member Brown-Shreves. Thank you. Changing gears, in the wake of recent world events, Ottawa Public Health continues to be mindful of the impacts stressful events can have on our mental health and well-being. These events can challenge our coping skills, no matter our age, background, or beliefs. Pour aider les gens à traverser les périodes de stress, Santé publique Ottawa a mis au point plusieurs ressources, notamment des fiches d'information qui peuvent être téléchargées à partir du site web de Santé publique Ottawa. These fact sheets are currently available in English and French, but will soon also be available in Arabic and Hebrew. I encourage people to visit OPH's Responding to Stressful Events webpage to learn more on how to talk to children and youth about their feelings during stressful events, recognize the signs of stress and ways to overcome stressful events, and knowing when and how to get help. Information for supporting children and youth can also be found on OPH's Parenting in Ottawa Responding to Stressful Events webpage. OPH will continue to work to build resilience, improve physical and mental health, and help residents deal with life stressors and challenges. Now, more than ever, it is important to take care of ourselves and our loved ones. Le 24 novembre, la vice-présidente de Giovanni, le membre Bauer et moi-même avons rejoint nos pairs d'autres conseils de santé et unités de santé publique pour le symposium d'automne de l'Association des agences locales de santé publique, ALPHA en anglais. The top-of-mind issue for the sector is the voluntary merger of local public health units. Since August, when the Government of Ontario announced that one-time funding, resources, and supports would be offered to local public health agencies that voluntarily merge, some boards of health, primarily in smaller communities and rural regions, have started exploratory discussions with their neighboring counterparts. The province has indicated that cost savings is not the intended goal of any voluntary merger. Rather, the goal is to reinvest any savings from mergers back into expanding programs to serve more people. Here in Ottawa, the previous Board of Health has taken the position that there is a net benefit for Ottawa Public Health to serve its more than 1 million residents by maintaining its existing governance structure within the City of Ottawa. As part of this board's due diligence, I have reached out this week to my counterparts in neighboring boards to seek their thoughts on the announcement made by the province and offer any support should they choose to explore voluntary mergers. I have also asked OPH staff to explore different scenarios and inform the board about any potential implications arising from the plans of our neighboring health units. I will keep you all updated on any new developments related to this issue. On December 1st, which marks World AIDS Day, Ottawa Public Health was represented by Patrick O'Byrne, a nurse practitioner at our sexual health clinic. Patrick, who is also a nursing professor at the University of Ottawa, is well regarded for his innovative work to improve access to the testing and treatment of HIV and other sexually transmitted infections. He is the driving force behind an online portal called Get a Kit, which provides a confidential web-based sexual health assessment to determine an individual's need for the testing of HIV and other sexually transmitted infections. For World AIDS Day, Patrick attended an event alongside elected officials, as well as representatives of the AIDS Committee of Ottawa, Max Ottawa, and the Canadian Aboriginal AIDS Network. Ensemble, ils ont rendu hommage à ceux qui ont perdu la vie à cause du VIH-Sida et se sont penchés sur les efforts en cours pour améliorer la prise en charge des personnes vivant avec le VIH. I want to express my sincere thanks to Patrick for representing Ottawa Public Health at this important event and for his tireless work as a champion for sexual health. With the holidays approaching, I want to encourage our residents to safely reconnect with one another and continue to assess your own level of risk and the risk of those around you while gathering with friends and family this holiday season. Nous voulons tous nous réunir avec nos amis et notre famille, et nous voulons que tout le monde reste en aussi bonne santé que possible et que les hôpitaux continuent de fonctionner pour soigner nos familles si et quand nous en avons besoin. With respiratory illness circulating in our community, this may mean making hard decisions if someone in your household is sick. If you are sick, please stay home and do not gather with other people. Vaccination continues to be the most effective way to protect ourselves and our loved ones from the most serious effects of respiratory illnesses. I encourage everyone to get a COVID-19 vaccine and their annual flu shot if they haven't already done so, and ensure all routine immunizations are up to date. It is not too late to get your flu vaccine. People over 6 months of age can also receive their new COVID-19 shot if 6 months have passed since their last vaccine dose or confirmed infection. Vaccines are available at your local pharmacy or through your primary care providers, and it is safe to receive both the COVID-19 vaccine and the flu shot at the same time. We know that the holidays can be a difficult time for many. Check in with your loved ones and your neighbors. If someone is having difficulty coping, there are resources to help. Again, a list of local resources can be found on the Ottawa Public Health website at ottawapublichealth.ca/mental health resources. J'aimerais terminer en vous souhaitant des joyeuses fêtes, tout en santé, happy and healthy holidays to everyone. But before I close my remarks, I would like to express my deepest thanks and appreciation to Deanne Blais, who is coordinating her final board meeting tonight as our board secretary. Deanne has provided me and my office with valuable support since I took on the role of Board of Health Chair, from ensuring I have the documents I need for meetings, to providing me with procedural advice and keeping me on track to complete action items. She is always diplomatic, and she exemplifies integrity and impartiality, which is what makes her an exceptional public servant. Thanks to Deanne, our board consistently fulfills our provincially mandated duties to the highest standards of openness, transparency, and accountability, enabling us to earn the trust of the residents we serve. Au nom de tous les membres du conseil, je te remercie, Diane, pour ton dévouement et ta contribution au Conseil de santé et à santé publique Ottawa. We wish you the absolute best in your very well-deserved retirement. We know you hate attention, Deanne, but it's well-deserved. Thank you. With that, is my verbal report received, or does anyone have any questions? Thank you. Now on to item 8.2, Medical Officer of Health verbal report.
All right. Thank you to the elders also for opening our meeting well and pointing to some of the teachings of their ancestors, I think, that are relevant. So I do also want to recognize employees, all of the OPH team that has been with us through the pandemic. I want to begin by expressing my gratitude, and it is hard to say this, but nearly 4 years have gone by since the start of the pandemic response. And during this public health emergency, really every member of Ottawa Public Health went above and beyond the call of duty to support the residents of Ottawa to be as safe and healthy as possible. And this month, you saw in our 2024 budget report, Ottawa Public Health is reaching the final phase of our plan to demobilize the dedicated funded COVID-19 response. This will end in the first quarter in line with the sunsetting of the provincial specific COVID-19 funding. And I will describe later how we are planning to continue our COVID-19 work. But when I look back on the past few years, it really is inspirational, the dedication and commitment of both the temporary and permanent employees that served the people of Ottawa through this period. Quand je repense à ces dernières années, je suis inspirée par le dévouement et l'engagement de nos employés temporaires et permanents au service de la population d'Ottawa. You might have heard me say this before, but it is also quite something to remember that from a team of about 500 full-time employees in March 2020, Ottawa Public Health rapidly increased our workforce sevenfold to more than 4,400 full-time equivalent employees at the peak of our pandemic response. This was with much help from City, Human Resources, Information Technology, and other staff. I'd also want to recognize that. And we have been decreasing this number since the peak of Omicron arriving in our community in January 2022. All the boosters we were trying to get out urgently, all the outbreaks we were still managing, and case and contact follow-up was happening at that time. But now we'll be back down to about 500 people in this spring of 2024. It was the majority, really the largest number of that expanded workforce were focused on immunization. And we've seen the demand for COVID-19 vaccination has come down, and so that we're able to meet that demand in the community now. Each person's demonstrated enormous flexibility in adapting and managing so much change in such a short time. It is clear, and I'm looking around the room, I know people feel this, that in this process, really deep bonds and friendship were formed. And that really enabled us to work together and be more than the sum of our parts. I'm really particularly proud of how team members developed innovative solutions to really support residents with the least advantage to access COVID testing and vaccinations in a timely way, which undoubtedly saved many lives. Je suis surtout fière de la manière dont les membres de notre équipe ont conçu des solutions innovantes pour aider les résidents les moins favorisés à accéder rapidement aux tests et aux vaccins COVID, ce qui a sans doute permis de sauver de nombreuses vies. And many of these innovations are now being applied to other Ottawa public health programs and services as we resume our core services, and we're reimagining new ways to better serve equity-denied groups. Such as Indigenous populations as well as African, Black, and Caribbean communities. The data show us that these populations face greater barriers in accessing health services, which negatively impacts health outcomes. And so finding new ways to work in partnership with Indigenous, Black, and other racialized populations will be a focus of Ottawa Public Health's work in the years to come. And that's a key lesson learned from our pandemic response and a lasting legacy of employees who worked with us through the pandemic. So we want to say thank you, a merci, a miigwech, and hopefully in some cases until we meet again. But I want to offer every single person who worked at Ottawa Public Health on the pandemic response my sincere thanks for your leadership. Thanks also to your families who supported you to be able to do this work. I hope each of you will look back on the contributions you've made to the people of Ottawa with the same pride that I have for you. And although Ottawa Public Health is reaching the final phase of our plan to demobilize the dedicated COVID-19 funded response, it doesn't mean that our work related to COVID-19 and respiratory illness is coming to an end. Addressing communicable diseases remains a core function of public health. It means we don't have the same resources as we did earlier in the pandemic in emergency mode. And going forward then, that our work will be funded out of our base budget as opposed to the dedicated COVID funding. Thank you, Chair, for mentioning preparing to protect yourself before maybe holidays and gatherings, but I am concerned. I'm concerned about the levels of respiratory virus circulating in Ottawa, about the impact on Ottawa residents, especially people at higher risk, and the pressures on our healthcare system. Currently, the levels of COVID-19 circulating in our community are very high, and they're increasing. RSV activity is high and stable, and influenza activity is increasing. When I think forward to late December, early January, this is a holiday period for many, And it's often when illness from respiratory viruses peak and when there's the highest pressure on our healthcare system. So that's a few weeks away. And I encourage everyone who hasn't yet gotten an updated COVID-19 vaccine and the annual influenza vaccine to do so now. And this next paragraph is probably the most important message I do have for people tonight. We are continuing to see the highest rates of hospitalization and death from COVID-19 in older adults, people over 60 and especially over age 80. A significant number of older adults' immunity against COVID-19 is waning, since they've not been infected by the virus and their last vaccine dose was more than 6 months to a year ago. So many older adults remain at risk. And today, we see the wastewater levels of COVID-19 are higher than this time last year, and hospitalizations are higher than they were at this time last year. So there's no shortage of updated COVID-19 vaccine, no shortage of influenza vaccines. The time, if you're over age 60, to protect yourself before the holiday gatherings is now. Nous continuons de voir les plus hauts taux d'hospitalisation et de décès de la COVID-19 chez les personnes âgées. Je voudrais maintenant implorer la population des gens qui ont plus de 60 ans à se faire vacciner contre la COVID-19 et la grippe le plus tôt possible avant les fêtes. And people who are at higher risk of complications from COVID-19, potentially eligible for antivirals, they are encouraged to test and access antivirals. And to support this, we are continuing to make rapid antigen test kits available at various locations across the city. At this time, Ottawa Public Health Library locations. You can check our website for any updates. Ottawa Public Health continues to be committed to raising awareness about COVID-19 and other respiratory illnesses through our comprehensive communication strategy. We're using targeted social media. We're continuing the local respiratory trend reporting on a weekly basis. We're doing media interviews, advertising, community outreach. And we're going to keep residents informed about mitigation strategies through collaboration with partners and other health units in our region, just enhancing our ability to share crucial information and really ensure that residents have what they need to navigate this season. A couple more words about our ongoing COVID-19 response, just to say that many teams have an active ongoing role to address the burden of respiratory illnesses. This includes COVID, and it is clearly part of the work of our outbreak management team that we bolstered because of the additional burdens. That outbreak management team helps minimize the impact of respiratory illness in congregate settings. Ottawa Public Health epidemiology team keeps the public informed about the status of respiratory activity in Ottawa through our dashboard. And we also publish that information about the respiratory transmission risk assessment for healthcare settings. And I want to thank our healthcare partners for also increasing their protections. And lastly, Ottawa Public Health Immunization Team is responsible to distribute COVID-19 and influenza vaccines to primary care, long-term care, retirement homes, and hospital settings. And currently, the Ottawa Public Health Clinics are offering COVID-19 to all residents and influenza vaccines, also with a focus on children under 5 and families who don't have access to OHIP coverage. We're supporting the rollout of the new publicly funded RSV vaccine in eligible retirement homes where they do not have the support they need to administer vaccines in their facilities. Deanne, I'm also going to pause to say that I want to really thank you. Merci beaucoup. Deanne, we know, is retiring after a 30-year career in work with the city, including almost 8 years with Ottawa Public Health. These are formative years. Deanne has helped shape what we do because the Board of Health is new. Not everyone might realize, but we're relatively new as a Board of Health. Je veux aussi profiter de l'occasion pour remercier chaleureusement notre secrétaire du conseil, Diane Blais, qui prend sa retraite au début de l'année après une carrière de 30 ans à la ville d'Ottawa. So board members, you know her as your point of contact, a calm, steady, and dependable presence who provides you with the legislative and administrative support that you need to fulfill your provincially mandated duties. What you don't see all the time is how Diane works behind the scenes really every day to make Ottawa Public Health and the Board of Health an open, transparent, and accountable institution, one that is worthy of your trust and the community you serve. So Diane, on behalf of all of your colleagues and friends here at Ottawa Public Health and the Board of Health, I want to offer you my deepest gratitude for your contributions over your whole career and with us. You've left Ottawa Public Health, I just want to say, and the Board Secretariat in a stronger position than when you joined. And we will miss you, but we do wish you a well-deserved retirement and much time with your family, which I am looking forward to meeting maybe later. Thank you. Merci beaucoup. So just a couple more things I want to just recognize. It isn't today, but very soon, December 6th, that we have the National Day of Remembrance and Action on Violence Against Women. And violence against women is a major challenge to health and well-being that we're concerned about in public health. It's also a violation of women's human rights. La violence à l'égard des femmes constitue un problème majeur de santé et de bien-être et une violation des droits humains des femmes. Globally, it's 1 in 3 women that experience physical and or sexual violence in their lifetime, mostly by an intimate partner. So 1 in 3 is really a stark reminder of the scale of gender inequality and discrimination against women. Just look around the room, we can imagine. The Canadian government has endorsed a 10-year national action plan to end gender-based violence, which sets a framework out for anyone facing violence to have reliable and timely access to protection and services no matter where they live. And this is needed. I would say also we need prevention. And so locally, the United Way is highlighting and supporting organizations that work on prevention, really pointing out that every week in Ontario, a woman, child, trans woman, two-spirit person, or gender non-conforming person is killed by a man. So Ottawa Public Health will work with these partners and others working with the Community Safety and Wellbeing Plan, where this is a priority, and so thinking both around prevention and supports to people who are escaping violence. I also recommend on this subject to take a moment to learn more about the murdered and missing Indigenous women and girls and two-spirited calls for justice that OPH wholeheartedly supports to contribute to tackling the root causes of violence and improving the quality of life for women, girls, and too as LGBTQAI+ people. We're going to return, I think, soon to our strategic action plan, so thank you for holding that, Member Bauer. I won't spend too much time commenting on it, but it will be our guide, the strategy into the new year when we think about our area of focus and the scope of our services. We're going to continue the work on infectious disease. Not every program is mentioned in the strategy and the action plan, but I think when you take a look at it, you see every team is implicated. The work there to shift how we work with community engagement and a focus on equity and measuring outcomes, measuring impact, I think is relevant to all of us. And that's our next stage as well, to promote awareness of what this means for every employee at Ottawa Public Health. We are going to continue with other pieces of work. The neighborhood health and wellness hubs are continuing. We'll have vaccination continue in those settings. We see with the shift in how COVID work is funded that we'll probably have 1 rotating community clinic versus our 3 fixed clinic model approach right now. And we will continue to rely on pharmacies as well as some primary care practitioners to assist with continuing to make various vaccines available. And so since the board approved the new strategy, we've been working on the objectives, the plans, and performance measures to guide our action. The The team that put this together included the senior leadership team, associate medical officers of health, program managers, supervisors. We consulted with experts across the city and many frontline employees. And so we drew on public health knowledge, along with the insights gleaned from consultations in 2023 from employees, partners, and board members. So hopefully you see some of your input in the action plan. We will take this, but we will remain adaptable, and we'll be prepared to make adjustments to our work plans in response to changes in our community's public health needs. So that would include adjusting our strategies to respond to any evolving community health challenge. Bien sûr, nous resterons adaptables et prêts à modifier nos plans de travail en fonction de l'évolution des besoins de notre communauté en matière de santé publique. So 2024 will, like most years, be most likely an exciting and a productive one for Ottawa Public Health. And I know that I speak for many when I conclude the year saying thank you on our behalf for your support over the year. Merci beaucoup. Je suis ici pour des questions.
Thank you, Dr. Etches. Does anyone have any questions? Seeing none. Oh, Member Gower, you got your hand up there just in time.
Thank you. I guess I wanted to ask about the uptake or lack of uptake in COVID vaccinations. There was a lot of data in there. And are there 2 or 3 metrics that we should be watching? Like if they go up over the next month, we're heading in the right direction. What should we really be looking at? How do we measure whether we're having success in getting more people to go out and get vaccinated?
Thanks. I can start, but of course I invite any members of the team that want to add. Certainly we do really point people to our dashboard about respiratory illness in the community, because that tells us what our risk is, what's out there. And that's what I was highlighting, that there's a lot of respiratory illness. It's probably, we see it's only going to increase over the next number of weeks and last into the new year. So that's the risk level. In terms of what's the impact on our community, that's where we look at hospitalizations, and that's where I think people might not realize we're in worse shape than we were last year. And to me, that's a warning right now, because again, our hospitals only have so much capacity going into the winter. And then in terms of how are we preventing this from getting worse, or how are we mitigating the situation, we have a lot of internal measures we look at in terms of outbreaks and numbers, and how long do the outbreaks last, how many people get infected in an outbreak, trying to make sure those are as limited as possible, and then the vaccine coverage. I want to acknowledge the hard work of the team and say that they're actually leading in the province at this point in terms of all of the coverage rates that we see across health units. The Chief Medical Officer of Health recently shared with me that we're at the top of the list for coverage rates, but I don't really want to celebrate that because it's low. It's still about 1 in 10 people who are eligible, so over age 6 months, that have had an updated COVID vaccine. And that means there's a lot of people who don't have enough protection. So we're watching that coverage rate. We're not over yet. People are still coming forward for vaccines, but I think especially where we know that serious illness can result, that ultimately is what I'm speaking about as a priority today. We look at the coverage rates for people over age 60 and over age 80. And still there is room to improve. Does that answer your question? Does anyone want to add? I think, yeah.
Yeah, and it was good messaging today in the media. I think it was probably coming from the Ontario Chief Medical Officer, just reminding people about it takes 2 weeks for a vaccine to become fully activated. So there's still plenty of time to take advantage of that before we get into Christmas holidays and so on. So I hope we do hear continued messaging from Ottawa Public Health as we have been, but also some more reinforcement from provincial officials and maybe even federal officials as well, just to make sure all of this information's top of mind for people. Thanks for the information.
Thank you, Member Gower. Vice Chair DiGiovanni.
Thanks, Chair. I wanted to actually go back to perhaps tie in some of your comments, Chair, with Dr. Etches as well. And so I guess, first of all, thank you to the board for supporting the attendance at Alpha. I thought it was a really fantastic symposium, and certainly the core was around changes of public health units in the province. The other piece that I thought I would highlight as a theme was both from Kieran Moore, Dr. Kieran Moore, as well as from Public Health Ontario, about the advanced role of analytics that they see as important in supporting and I would say proving or reinforcing the value of public health. And I just wanted to point out that I do think OPH is a leader here, and so would encourage staff to really be maintaining those relationships. Because I think we can both influence the metrics that are followed and help that inform our strategic plan as well. So just knowing that that's an initiative from Public Health Ontario, I think that'll be really important for OPH going forward. And similarly, the other piece that I was heartened by was the encouragement for all public health units to form close relationships with Ontario health teams across the province. And I was surprised to hear that some hadn't. But also reflected that OPH is a signed member of, I want to say 4, if not 5, local Ontario health teams. And again, I think strategically that positions us well for the initiatives that are to come through the Ontario health teams, and things like looking at the population immunization status, and really how we can work together with primary care to be looking at the health of the population in different ways. So I was proud of how OPH has positioned itself, because I think it really is in line with some of the initiatives of the province, and encourage that going forward too.
Thank you, Vice Chair. I agree with you. That's one of our core functions, is population health assessment and surveillance, and having the data to inform local decision making. We are excited that some routine reporting could happen at the provincial level by Public Health Ontario that takes breakdown by health unit. And that would relieve us potentially of some reporting, but we still need that specialized, dedicated team to do the work with partners locally, right? So I think we're excited about the potential, and we see it's in our strategy as well to figure out how we use our information to work with healthcare, to really aim towards better outcomes. There are many, now I'm going to get too off topic, but many things we could work on in terms of, making sure people are understanding of whether they're diagnosed with HIV, on antiretrovirals, have suppressed viral loads, how we increase our coverage of HPV vaccine. It's low. Like there's many metrics where if you provide people with the right information, access to opioid agonist therapy, Suboxone, we know there's a lot more we could be doing to make sure everyone has treatment for opioid substance use disorder. So these are the kinds of things where that work our team does to get the local data with partners through the OHTs, I think could really improve outcomes. So thank you for noting that.
Well said, and thank you for attending along with Member Bauer. I thought it was informative, definitely. Okay, I'm not seeing any other hands, so is the MOH's verbal report received? Thank you. We will move on to item 8.3, 2024 draft operating budget for the Ottawa Board of Health. I'll invite Kibria to come up to give the presentation.
Honorable Chair, board members, my dearest OPH team, and distinguished members of the community, good evening. As you consider the 2024 draft operating budget tonight, we will provide a high-level recap of the details of the budget since our November 6 meeting. To recap, we presented a balanced budget aligned with city and provincial budget directions for 2024. We focused on returning to breadth of public health practices. We incorporated municipal tax-supported increase of 2.5% and a growth allocation, as well as provincial restoration of base budget and an increase of 1% to our base budget. We developed our budget based on few assumptions. We assume the province will offer the opportunity of one-time within-year funding to support OPH programs and services. We also assume federal, provincial, and municipal support to improve social determinants of health, including access to affordable housing, primary health care, mental health, and substance use health services. You may recall this detail from the draft budget that we presented on November 6. For 2024, we are presenting a balanced operating budget of $87.5 million, which is broken down as an $80.7 million base budget to support provincially mandated programs and services, and a $6.8 million one-time budget to support the COVID-19 program wrap-up in Q1 2024. We expect revenues from three sources: $55.8 million from the province, $28.2 million from the city of Ottawa, and $1.3 million from other sources. The 2024 operating budget is $43.9 million lower than the 2023 approved operating budget, mainly due to the ending of dedicated COVID-19 operations by Q1 2024. The budget document was posted online as of November 6, as well as a dedicated email address, telephone number were made available, and invitations were extended for written submissions or the options to register to speak at tonight's meeting. We have received 7 written submissions from the residents. The next steps for Board of Health consideration tonight include the following recommendation. We are recommending approval of 2024 draft operating budget. We are also recommending that Board of Health direct staff to forward the budget report and amendments to Ottawa City Council for considerations on December 6 meeting. And finally, that the Board of Health direct the Medical Officer of Health to forward the 2024 annual service plan and budget submission to the Ontario Ministry of Health for consideration based on the approved 2024 operating budget. Ceci conclut ma présentation. Nagurmik, Miigwech, merci. Your questions are welcome.
Thank you. Do we have any questions? Go ahead.
Thank you, Chair, and thank you for the presentation. I wanted to ask about a note that was in the assumptions section of the budget documents that you received about the neighborhood health and wellness hubs. And Dr. Etches referenced these bodies in her opening remarks, and the board had an opportunity to visit one in Member Carr's ward, and it was a great demonstration of a very nimble service organization. I think the note said that it may be contingent on one-time funding. I would just wondered if we have funding in our base budget moving forward to maintain these hubs at the present capacity, or is there dependency on the provincial budget?
Thank you for the question. We do have allocated resources from our base budget to maintain services through Wellness Hub, but we did receive one-time funding from the province this year, which will be until March 2024. But going forward, we continue to see a need for more funding because of the high demand for the services, and we like to apply for one-time funding next year because we have an opportunity to apply for one-time funding.
Great, thank you.
Thank you, Member Bauer. Member King.
Member Bauer actually asked my question because there's, I see the tremendous benefit in terms of this model as well, not just touring Member Carr's wellness center within her ward, but also the two that are in my ward with the ABC Wellness Resource Center, as well as the Rideau Rockcliffe Community Resource Center as well. And we know that there's a myriad of programming, whether it's vaccination, connections to employment and social services, dental screenings, access to mental health, addiction and substance health resources, diabetes screenings, as well as parental assistant drop-ins. So I was just curious as to speaking towards the value of the program. I'm just wondering if staff can speak to how many people utilize the services and how many communities take advantage of the hubs.
It looks like we'll want to share our evaluation of the hubs with you. We're currently evaluating the approach as well to look at the metrics across the different sites. We've continued to shift the locations and adapt the services available in the hubs based on what we see the needs are, based on the uptake. So I think what we see is they are staying. There's base funding, there's a foundation, and the opportunity to grow them needs to be guided by the community. So that's partly why the evaluation is being done, and we'll have community input. And some of the growth might come through one-time funding, it might come through partnership. So like you mentioned, some social service partners, other partners that may want to build on what's there. But I invite anyone else. You want to add anything? It's okay.
And if there are no additions to that, I just had one follow-up question, which is how much funding is required to ensure the continuity of the service delivery model?
So it will continue. That's in our base. In terms of how much we could do with more funding, I think that may be what we sort of monitor this year as we go forward and look forward to next year in terms of a costed out sort of approach to what else might be done. I don't know if that makes sense, Kibria. Yeah.
Yeah, thank you. As Vida mentioned, that we are also evaluating the approach, and because when we started, actually we started during the COVID-19 response, and we are going back to the normality, and it is important for us to adequately estimate how much funding is going to be required to sustain these services. We are working on it, and I hope we will be able to do proper estimation the next quarter.
No, I appreciate that. I appreciate the efforts of staff in terms of working on the neighborhood health and wellness hubs. I know that at the last meeting of the Board of Health, I had mentioned anecdotally the high use. I went on a weekend to get both my COVID and flu shots, and I had to return because so many people were there taking advantage of the service. And I think what was exciting about it as well is what I observed was a lot of newcomers, newcomer children actually getting their first vaccinations. So I think it makes a lot of sense for us to go into the communities, especially high priority communities, and directly offer these services. And I look forward to the research and the reports that you'll furnish in terms of the adequacy and the efficacy of these hubs, because just anecdotally, we can see the need, and we can see that these services are well received in the community. Thank you.
Thank you, Member King, and thank you both for highlighting the hubs and their value. It's certainly been central in my advocacy efforts to the province to show that their value and the potential of expansion. So thank you for raising that. Member Gower, please.
Okay, thank you. Could staff clarify for me again the removal of the cannabis program budget that's in one of the 2024 pressures? Can you explain what that is again?
I'm not sure if you heard the question, Kibria. I'll just start. So when cannabis, the regulatory model changed, there was an intention for revenue to go to municipalities that decided to open, that they would allow storefronts to open. And that revenue would flow to municipalities to assist with some of the adaptations required. And part of that funding came through us. It's actually, it goes from the city to us, back to the city, to do enforcement. So we rely on our partners in bylaw services to do enforcement related to the Tobacco Act and also cannabis. So that revenue has dried up. That's why it's mentioned in the budget. We're not getting that revenue from the province to the city to us to flow to bylaw. We would like to maintain enforcement activities, and so it's a budget pressure. And that's my explanation. I'm not sure if Kibria wants to add anything, but.
Thank you, Vera, for highlighting this. As Vera mentioned, that the revenue dried up, so we are planning to fund that from our base budget next year, but we also plan to critically review our approach going forward, because if we don't have a revenue from the province, so it's a pressure for us going forward. So next year we will critically review that how best we can approach that.
And do we know that was in some ways coming from profits expected to be generated from cannabis? Does that mean they're no longer generating profits, or is it just they've put a sunset on that funding stream to municipalities overall, or both? I don't know.
Sorry, we haven't found an answer to that question yet, Member Gower. I'll keep asking. But the reality is we're going to make this a cost-shared rather than 100% provincial funded effort to continue to enforce, because you can see the need, as one of our reports tonight showed, that vendors are selling to minors or people who are underage. So that is something we wanted to address. Okay.
My next question was about the 4 assumptions that are listed in the staff report. I think the first 3, they're reasonable assumptions because we either already see these things happening or, well, the COVID top-up funding or one-time funding reasonable to assume the province will continue what they've done in years past. I hope it's reasonable to assume. But it's the fourth assumption that I was wondering about around the technology. So are we making the assumption because we've been told by the province they will be contributing money toward us? Or what's that assumption based on?
Again, I'll start, but Cameron Keys may want to add. We have it on good authority from the Chief Medical Officer of Health himself that the province is very interested in improving the databases and the systems, the technological solutions for public health, so that we can have data as a system across the province that they can access and use for multiple purposes provincially, to benchmark and improve outcomes, advocate for funding. I don't know, we'll see. But the point is, we don't know about money, but we know they're working on systems, and so there would be some efforts required to implement that we would expect. They'll have to take that into account. Cameron?
Yeah, I think that's absolutely the case. I think we don't know about the money, and we also don't know a lot about the timelines either. So there were some provincial initiatives underway, and the province put a hold on a few of these smaller initiatives to think a little bigger, a little broader. And since then, they've gone back and done some visioning and thinking about how we can connect things in bigger and better ways, but we haven't had much of an update. And so, yeah, we are unsure at this point about the timing as well.
So I guess my concern is about what level of risk we might be looking at if it doesn't advance in 2024. Does it present a financial risk? Does it present a organizational administrative risk? Like what are the consequences if that assumption doesn't hold true, I guess?
We are left working with systems that aren't ideal in terms of the work we do. Sometimes involves paper still. We'd rather have digital solutions so that people can access information wherever they are. And, for quality control, our hospital colleagues know that it's important. Errors are made every time you write something down. There's a risk. We're also really stretched with our current capacity to fund those who maintain our information technology systems and solutions. So, I hope to speak more about this more to the board when we talk about risk, but it is one of our top risks, is that we don't have the ability on our own to expand our solutions. And in fact, it also doesn't make sense for us to go on our own if there will be provincial solutions coming. So we're kind of in a waiting mode, trying to make the best of this situation, but it isn't entirely comfortable. We would like to see things move along. So it's a conversation with the province as well.
Okay, yeah, and I know it's been mentioned in previous reports as an area of risk and concern. So the last question is just, I wanted to look forward to 2025 and 2026 and ask if Dr. Etches or staff wanted to highlight any budgetary concerns or risks going forward that we should be aware of heading into future budget years.
Thank you for the questions. One of our concern, not only for future, like even from the past, actually, that our city's contribution, in-kind contribution from the city's corporate departments, it values around $10 million. And historically, this has not been considered as part of the OPHS budget by the province. And that means province is not contributing to their share to this. And that's why you will see the proportion between City of Ottawa and the province is not 75-25 actually. City of Ottawa is paying almost 37% of the cost shared budget. So that's an ongoing concern, and we discussed with the Ministry of Health, and Ministry of Health shared that they are going to review the funding formula over the next 3 years, and we like to take part in that process to make sure that this $10 million is acknowledged by the provinces as part of the cost share budget. That is one point. The other points includes the population is growing, the inflation is increasing, the growth of the budget is not proportionate to that. And going forward, we expect actually there will be more need to provide public health services. There will be also pressure on public health services if the province fails to invest more on primary health care. There are populations who are outside of the access to primary health care. There will be more pressure if the province does not invest more on mental health, substance use health. So these are some of the concerns that we have in 2025, 2026.
I'll just underline that, to raise that a 1% increased contribution from the province each year does leave us behind what we need to maintain services. And so at the same time as all these pressures that Kibru was mentioning, we may have to make cuts to our budget if we aren't able to find additional revenue at a time of increased demand. So we've worked hard this year. I thank you to the whole team to reallocate resources. And so that's how we're managing this year. We did that work, so we don't have that option to find solutions next year. The work to reallocate towards these areas of infectious disease pressure, other pressures, we've already done that. So it will continue. Every year we'll review all of our expenses, look for efficiencies, but we're going to have challenge most likely into the new year unless 25, 26, unless the province does shift that approach to public health funding in the sector in a positive way, which is a possibility. So we appreciate the review. And I would say I want to end on a positive note that, in fact, the Chief Medical Officer of Health has acknowledged that cities, larger cities, diverse cities, have not had the funding growth to keep up with population change. So that's been acknowledged.
Okay, well, I'm glad to hear that. And this is a familiar theme we're hearing in a lot of our departmental budgets across the city, the difficulty in sustaining this approach for year after year. So thank you for the information tonight. And overall, I'm really happy with what I see in the budget for public health. Thank you.
Thank you, Member Gower. And I'll just add, I think when we tabled the budget last meeting, I said, our advocacy as a board was really focused on ensuring that the province reverted that funding formula. We would have been in a much different situation for this budget had that not happened. But certainly, based on that last answer, there's more work to be done. There's more advocacy, and certainly that'll be a focus for myself and for the entire board in the year to come. So thank you for that. I don't see any other hands. Do we have any other questions? Okay, I do want to acknowledge that we did receive written submissions from Jessica Turner, Mike Buckthought, Rebecca Wetlaufer, Morgan Titero, Michaela Smith, Angela Murray, Scott Farley, Olivia Sullivan, and Liz Radzik. These submissions were circulated in advance of the meeting and are held on file with the Board of Health Secretary. And I do want to echo thanks to Kibria and your team. It's always a challenge to present a balanced budget, and I know your team worked exceptionally hard this year on this. So thank you for all of your hard work. We will move through the budget roadmap motion, and there's no declarations of interest. So Member Brown-Shreves, you can read the entire roadmap, and we can vote on it in bulk. That works for you.
Budget roadmap motion that the Board of Health for the City of Ottawa Health Unit 1 approve the 2024 draft operating budget for the Ottawa Board of Health outlined at document 1 as follows. A, page 5, Ministry of Health Programs and Standards. 1, cost shared core programs. 2, Ontario Seniors Dental Care Program. 3, Healthy Babies, Healthy Children. 4, 100% city programs. 5, miscellaneous programs. 6, COVID-19 one-time, and B, page 9, user fees. 2, upon the Board of Health's approval of the 2024 draft operating budget for the Ottawa Board of Health, direct staff to forward the report to Ottawa City Council for consideration on December 6, 2023, as part of the City Council's approval of the City of Ottawa 2024 draft operating and capital budget. And 3, upon approval of the 2024 draft operating budget for the Ottawa Board of Health by the Board of Health and Ottawa City Council, direct the Medical Officer of Health or delegates on behalf of the Board of Health to forward the 2024 Annual Service Plan and budget submission to the Ontario Ministry of Health for consideration based on the approved 2024 operating budget for the Ottawa Board of Health.
Is that carried? Thank you, everyone. Okay. Thank you, Kibria. All right, we will move on to the next held item, which is 8.4, Ottawa Public Health Strategic Plan for 2023-2027 Strategic Action Plan. And we can begin with you, Member Bauer.
Thank you, Chair. I have 3 comments or questions. First, I would just like to acknowledge the great work that staff has undertaken over the past months to take what we saw in the fall as a very high-level framework and really drill down into some very tangible 5-year outcomes. I think across all the strategic objectives, there was a real sense of what the vision was in terms of working towards, and tied to some very tangible performance indicators. So kudos to the goal teams. I really found it a really fine piece of work. My second question actually was raised by the Vice Chair and Member Gower. It was around data analytics and systems. It was gratifying to see that woven throughout the strategic plan. There was a lot on data governance, implementation, visualization, our dashboards, products, but I didn't see anything on systems and platforms, which was, I think, raised as a risk in the budget by Member Gower. So it was raised by Dr. Moore at the Alpha Conference. I think it's a huge risk. You need the systems and platforms, whether it's on site, in the cloud. Maybe that's another sort of advocacy project now for the province maybe to work with them on a digital and data strategy that's a bit more tangible and real. I mean, Dr. Moore mentioned specific projects such as a centralized immunization registry. But again, there's a lot in a strategic plan that would depend upon the systems piece. The third comment and question is around strategic objective number 11, around our outreach and partnerships with healthcare system partners. I'm sure there's more to it. The outcome seems a tad modest in terms of arriving at an options analysis over a number of years, but perhaps I'm missing a bit of context on that one.
Thank you, Member Bauer. On the data analytics and trying to influence provincial systems and platforms, we won't be entirely held up by that because we have, the information we have now, we are able to continue to build on, especially around some of the determinants of health information. But we also have, I believe it's Dr. Laura Burns is on one of the provincial committees to shape some of the digital solutions. So I think that is one avenue. She's there on behalf of the Council of Medical Officers of Health. When it comes to objective 11, I probably could hand this over to Dr. Malachny to speak to it. I think the idea is this is not an outcome we would expect necessarily at the end of 4 years, but an initial outcome, so that we would then, having done this work, be able to set out other milestones. Do you want to add to that?
Yeah, no, thanks for the question. Yeah, you'll note for strategic goal 4, the other 3 items are quite precise, and they build on work that we already have, that's tangible. We know what's occurring. We can clearly state where we hope to be. And in some of those, it's a year away as well, like some of the provincial working groups that we're involved with. The last item which you were asking about, you could take on an awful lot of things there, and Dr. Etches, I think, named just a few. Whether you're looking at opioid agonist therapy, cancer screening, there's all kinds of areas in clinical prevention. So I think we were signaling we wanted to be really thoughtful about not taking on too much and being thoughtful where we could have the greatest impact. So we want to take a look at what the recommendations are for, currently for best practices. We'll want to talk to and think about at what level, or is it individual providers, is it organizations, is it on OHTs, is it Ontario Health East, is it OH, or some combination thereof. So there's a fair bit to think through there to get the most impact for the level of effort that and resources that we've available. So that's what that was signaling, and in terms of doing an option analysis and looking at, well, we've actually already started talking about that, but looking to have that done in less than a year, so that would then inform the rest of the plan over the timelines of the strategic plan. Thank you. You're welcome.
Thank you, Member Bauer. I'm not seeing any other hands. So is the report carried? Great, thank you. We have no in-camera items. Motion to adopt reports. Member Brown-Shreves, please.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal reports, and the reports titled 2024 Draft Operating Budget for the Ottawa Board of Health, Ottawa Public Health Strategic Plan for 2023 to 2027, Strategic Action Plan, Ottawa Public Health Submission to Health Canada on the second legislative review of the Tobacco and Vaping Products Act, and performance appraisal of the Medical Officer of Health in camera personal matters about an identifiable individual reporting out dates not to be reported out, be received and considered.
Thank you. Is this carried? Thank you. We have no motions requiring suspension of the rules. Do we have any notices of motion? Seeing none, confirmation bylaw. Member Brown-Shreves, please.
Be resolved that confirmation bylaw number 2023-7, a bylaw of the Board of Health of the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of December 4th, 2023, be read and passed.
Is this carried? Thank you. Do we have any inquiries? Seeing none, we will be adjourned. The next meeting is not until Monday, February 12th, 2024. So again, I'd like to wish everyone a very happy holiday season, Happy New Year, and thanks again for all your great work in 2023. Thank you. Merci.
Happy holidays, everyone.
Thank you.